So today we're going to talk about cystograms and VCUGs.
All right, so we're going to start out with the VCUG. These are normally taken on children and down to infants. Usually it can be one UTI, especially in an infant's newborn's life. When we do these, when I first started doing them, usually they had to have 3 UTIs before we would do a VCUG, but that has changed over the years. So depending on the age of the child, we have 2 catheters. Okay, we have a 8 French and a 6 French. So the 6 French is tinier, as you can see, compared to the 8 French. So usually newborn up to maybe 3-4 years old, and then from 4 on up, depending on the size of the child, they would use an 8 French. Mostly you're going to use a 6 French catheter, and these are actually the catheters. We used to use feeding tubes. They went away from that. So actually the nurse is going to come down and put the catheter in. She's going to need some sterile gloves. She'll need some gauze. She'll use the betadine swabs, and she'll also use like a Feddersen drape or some sterile towels to put around the child so that she can create a sterile area. She'll clean up. Usually during that time when the nurse is in, they will have you hold the legs apart and the feet together on the child to kind of help them relax a little bit and make it easier for the nurse to see as she cleans up the child and introduces this. They're gonna cry. There's no working around that. I try to tell the parents, and depending on the age of the child, that this should not hurt, but it will probably feel some pressure and a little uncomfortable because things are going the opposite direction. Kind of eases some of the stress, but still, they're gonna cry. Just plan on it. They're gonna cry. So what you're gonna do pre-exam is you're going to disconnect that. It gives you a hanging tool. You're gonna hang it up here on this IV pole. Okay, so it's hanging. Next, you're going to disconnect this cap. Actually, since we have a patient today, you're going to disconnect the cap, and you'll see that there is a rubber stop in there. The next thing you're going to do is you are going to connect this IV administration set. And stretch it out. You're going to take off the plastic cover. It's got a sharp point. It's going to go up here into, just push it straight in. Okay. Then next you're going to squeeze and allow some of that to go in. Always make sure you turn it off. So bring that little wheel down, turn it off. It's quite long, so it gets, tangled up, untangle it. So in order for it to drip more, you want to open up this little flap here so that it opens up. You can see that it's starting to drip more. And then we want it to fill the tubing. And you can leave the cap on for now. You want to open it up and watch it as it goes through. Stand like the Statue of Liberty. And you want to make sure if there's any bubbles, you want to get rid of those bubbles. You can control it by raising it up, getting it higher than the bottle. Let those bubbles get caught up. Kind of shake them up there. I feel like I'm making more right now. Get those bubbles up.
Why would you want to get rid of bubbles?
If you see bubbles in here, sometimes when they go in, they will show up as bubbles into the bladder.
Which would not be good for your study.
Correct. So slowly getting it up there. Sometimes it's a process until it starts to drip out on you. And then you can work them out a little bit more. Turn it off so that you don't get it too drippy. The next thing you're going to do is you're going to open up what you can call a Christmas tree or an adapter. I'll kind of get it more so you can see it. So one end connects to the tubing. The other end is going to connect to either the blue or the green part of the catheter. And this just twists on. So take that off and twist this on. You can leave it in its package so it stays somewhat sterile. You can also take that and put it in the glove.
Ooh, nice trick.
And then you can hang it up here. That way it stays sterile. I'm gonna wash my hands because it's sticky.
Yeah, so that contrast study, I know it looks like water, but it's not. It is very viscous, and so yeah, it will feel kind of like syrup water.
Also, your prep for your table, you want to put down 2 checks. Open them up, padding side up, because you want it to absorb some of the contrast. And then you'll tape these all down. We also have, and I've seen at a lot of facilities, it's like diaper material. And what you can do is open it up, and you can stretch it out. And what I usually do is I like to have a lot of coverage and a lot of absorbency so that it doesn't run everywhere. So I will start with 3 across, and then I'll go 2 to go over the joints, and then I'll do 1 on top. It might be a little excessive, but I don't like messes. So I like to have as much as padding there as I can. So this is for a VCUG, because once the patient's on the table, once the nurse comes in and gets the catheter up into the bladder, the radiologist is going to come in, and when the radiologist is here, he's going to tell you to turn on the contrast. You're going to turn it on, and you're going to watch on the monitor as it fills. And sometimes they'll look at it for a little bit, or they'll take quick shots where they just press it down a little bit, get a picture, and watch it. One way to explain to the parents and to the child, depending on their age, is it's like a balloon. It starts out small, and as you introduce the contrast, it starts to grow and get bigger and bigger as it is filling with the contrast. And then you tell the child or the infant, once they feel like peeing or voiding, go ahead, and then they just void on the table.
Hence the need for lots of padding.
So yes, lots of padding. You wanted to absorb all that.
Yeah.
Sometimes the radiologist will have you take a picture afterwards, post-void. Sometimes they're just taking it as the child is voiding, and they get enough images with the fluoro.
Do they use any compression for children?
No.
Okay.
Not that I have seen. Maybe in other places they have, but usually no. We just wait for the child. some tips, running water. I've made up songs. You don't want me to sing them to you. I made up songs along the way. Just talking to the patient, you know, tell them to relax, tell them it's okay to pee. You get those ones that have just been potty trained and all of a sudden, you know, it's okay to pee.
Taboo. Yeah.
Yes. So it's a little bit of a mind game for them to really relax and pee on our table. But sometimes it's a waiting game. Sometimes they do it right away. So that's pretty much the VCUG.
All right.
A cystogram is pretty much just looking at the bladder, whereas the VCUG, we were looking at the bladder, plus we were looking to see if the contrast retrograde up into the kidneys. But with the cystogram, we're just looking at the bladder. So it's pretty much the same setup. You have your contrast, you have your tubing, you have your adapter. Now usually for the cystograms, the patients come with the Foley catheter already in place. I have some drastic Foleys to show you the difference, and there are Foleys that are in between sizes. And those are usually the ones that they use. At the end of the Foley, this one I guess is better to see. Your adapter is going to go into here, and this one will be open. This is actually the one that they use a saline syringe to inflate the balloon. These have balloons on them. And so that will already be in place. So you do not want to touch this one, okay? Hands off. You're only going to attach the adapter into here. Usually the patient will do it. Sometimes you can do it yourself, but the patient will disconnect the bag from their leg, and I usually have a bucket close by so that they can set it in there. It helps keep it up because you're going to use it again. They're going to reattach it. Excuse me. They're going to reattach it. So putting it in here, and I usually will cover it with a sterile gauze because you want to make sure that everything stays sterile. You do not want them to get a bladder infection. So cover it with the gauze, put it in here, and then I just set it aside either over on the counter or on here. Then you're going to connect the adapter to the to this area here. Not very technical, sorry. Once that's all connected again, you do want to have some padding. This is not a voiding one, but sometimes you do get leakage once in a while. It just happens. So you don't really need the diaper material, but having 2 checks down will be sufficient to get anything if it does spill over. Your patient's laying there, and then again, the radiologist will come in. They'll ask you to turn this on, and you're just going to open up here, and it's going to flow in. They're going to watch as it fills the bladder, and they might have, depending on the area that they're looking at, they might have the patient do an LPO or an RPO. Sometimes if it's posterior, they'll have them do a lateral. They'll have the patient roll up on the left side and do a lateral. A lot of it is just APs. And then once they get the images that they need, the patient is all done. You can disconnect, reconnect their bag, and then they can use the restroom afterwards to either empty out the bag if it's starting to be full, or before they leave the department.
All right.